Dr. Lewis is the author of When Brains Collide, what every athlete and parent should know about the prevention and treatment of concussions and head injuries. Dr. Lewis, welcome to the show.
Hey, it's great to be with you today.
It's great to have you. We get to talk about one of my favorite topics, and I'm really excited to chat about this, and that is concussions, but also what can people do to prevent it? But then on the flip side, what can they do, after they've sustained one? First, can you tell people a little bit about yourself and your background and how you kind of ended up where you're at as a medical provider?
Yeah, out of high school, I grew up in a medical family. My father was a small town surgeon. My mother was a nurse. But out of high school, I went to the U.S. Military Academy, West Point, and off to play Army for a number of years. And woke up one day and said, what am I doing? I always wanted to be a doctor. So I ended up going to Tulane Medical School down in New Orleans and back into, through the Army program and back into the Army surgical internship at Walter Reed in DC, and every intention of being a surgeon, but they sent me out to do general practice for a couple of years, and I just covered nights and weekends, and something that surgeons don't know much about, and ended up in preventive medicine and public health and a variety of different things, training at Johns Hopkins University, Walter Reed Army Institute of Research, which really was a focus on international infectious diseases. And my first assignment out of there, I got sent to Bangkok, Thailand. And for a number of years, I was running around Asia as a disease hunter, looking for new and interesting things. And then the Army said, "You've got all this great experience. Come back and teach medical students back in Bethesda at the Uniformed Services University, the military medical school." And while I was there, now Iraq and Afghanistan were going on. You got wounded warriors everywhere, and I kind of started to put different pieces of things together. Put two and two together, and I came up with an odd number. And I went to the head of research at the Brain Injury Center, Defense Veteran Brain Injury Center. I had to think of it there for a while because it's changed names over the years. The head of research there, and I asked, is anybody looking at the use of omega-3s like you get from fish oil to help our soldiers recover from traumatic brain injury? And he thought about it for a moment, and he said, "No, why don't you?" I made every excuse I could. I was like, "I don't know anything about it." And he goes, "But you're the only one asking the question." And so that was a massive career change. And that was 18 years ago. I've been on that path ever since. Retired about 13 years ago and continued that path even after I retired in private practice, running a small nonprofit, but always with the idea that there's more we can do to help people recover from traumatic brain injury, or even better yet, prevent them.
Yeah, so you said about 18 years, so 2007. Why? I guess that's one of the big things, why were you the first person asking the question about these brain injuries? I mean, at that point in time, the war had been going on for a few years, lots of IED blast injuries and everything else. Like, what was happening?
Well, you would think, and this was what shocked me. To me, it was almost common sense. I was an outsider. I'm not a neurologist, a neurosurgeon, a trauma guy. I'm completely outsider, and I just, kind of, like I said, I put two and two together, came up with an odd number. But one of the seminal moments was in January 2006. There was a mining accident in West Virginia where 22 miners were trapped in a coal mine a mile underground after an explosion. And it took them 41 hours to get down to rescue them. And by the time they got down there, only one guy was still barely alive. And it was a young, previously healthy guy. But methane gas poisoning, carbon monoxide poisoning, his renal function had shut down, had massive heart attack, all the things that would kill you. and somehow he was just barely alive. And so they did hyperbaric oxygen and dialysis and all these different things, but they were left with a guy that still had basically no brainwave function. And the neurosurgeon was prompted and called Barry Sears, the zone diet guy. And Barry Sears jumped on a plane, came down to Morgantown, West Virginia, and brought some fish oil with him. And they started pouring it down the guy's feeding tube. And short of the stories, a couple months later, the guy walked out of the hospital. And I kept hearing about this and hearing about this. Very different situation. But what struck me was, well, the brain is the brain. Wouldn't that work for traumatic brain injury as well? I call it my brick wall analogy. If you've got a brick wall, wouldn't you want to use bricks to repair the wall? Well, omega-3s, DHA specifically, but omega-3s are essentially the bricks of the brain. So why not back up a truck and dump a bunch of these DHA bricks into the site and help the brain repair? And I had absolutely no other thing to go on other than it just made common sense to me. And yet, when I looked into it, I was the only one essentially the only one in the world, besides the neurosurgeon in West Virginia, who was even talking about this. And so I just kind of ran with it. To me, it just made sense.
Yeah, and there's a lot of things that we see in the concussion world that's now is starting to make sense. But in the past, it was criticized. It was like, oh, you can't rehab a concussion. What are you doing? Like, and now it's like, okay, everyone pretty much agrees you can do something. Now, not everyone's up to really where they should be. But as we're talking about concussions, before we truly go into the whole fish oil and what it can do, one of the biggest things I've seen over my career, we go back a little bit of my backstory. My wife had concussions back from when she was a teenager in car accidents that were never diagnosed, never evaluated, and all of her symptoms were getting blamed on hormones, changing, oh, you're going to a new grade, it's puberty, and different things like that. So what are things that not only parents should be watching out for in their kids who are playing sports or have been in car accidents, but also anyone should be looking out for, as concussions are so, unfortunately, still at this point in time, widely underdiagnosed?
They are, and it's really scary in many ways, but it's also the nature of the injury, right? It's the invisible injury. Guys in the NFL will say, I'd rather have my ACL blown out because everybody understands that versus, that terrible thing where you look at somebody, well, you don't look like you have a head injury because you don't see it. It's that invisible injury. And, even more scary is with kids. And so one of the things, and especially in teenagers, whether playing high school, hockey, football, rugby, soccer, basketball, name your sport. I'm a huge believer in team sports. I mean, I grew up playing football. I switched to rugby in college and beyond. I am on the board of advisors, the medical advisory board for Pop Warner Youth Football. I am on the board of directors for the National Collegiate Rugby because I believe in these sports, and team sports are hugely important. And the lessons you learn in life, where better to learn as you're growing up than through team sports. And unfortunately, collisions are part of these more aggressive sports, but can we make it safer is how I'm always looking at it. And we talk about different things like better helmets for football or lacrosse and things like that. But what we never have a discussion about, and it's starting, I'd like to think it's starting to change, but I'll back up for half a second. If you look at the sports concussion conferences that have been held over the last number of years, the most recent one in 2022, it's the first time ever that they came out with a statement saying that exercise after a concussion is important. Before that, it was go sit in a dark room. And so finally, we're recognizing that exercise is an important part of recovery, but not a single word about nutrition. And to me, that's the biggest thing. We're talking about better helmets and better protection. What about protecting it from the inside? And really, the only way you can do that is with nutrition.
Correct. And it's sad that exercise was neglected for so long. It was just, hey, go sit in a dark room, don't do anything. And then as you've talked about, nutrition is it's still not even talked about in the consensus statements at all. There's no thought about like, hey, what you eat actually matters for your brain health. And
yeah, it's pretty scary that we're still that far behind.
it is, especially with like the research is there. I mean, it's one of the things, right? If we were just like, hey, you know what, we just are coming up with this, but the research is clearly there to tell you, look, this can impact immune system function. This impacts how brains develop. If it impacts how brains develop, then it can ultimately impact how brains function and how they can even repair. So for those parents who are, they've got their kids playing in sports, we've talked about, teams, and they're like, well, I don't want to pull my kid out of a sport, but I'm also worried that they may take a concussion. What like needs to happen for a concussion to occur, because it's not losing consciousness, but what are some of those myths that people kind of hold on to that they really need to let go, because by holding on to it, they're kind of doing more harm than good?
Right. I mean, there's a responsibility of everybody and anybody in and around and on the playing field, whether it's the referee, whether it's the teammate, whether it's the kid himself, whether it's a parent on the sideline, or the coaches. The more that people are aware and can keep an eye out for things. I mean, I've been at rugby matches where I've gone down to the sideline and yelled at the referee, hey, number 8, he needs to come out of the game, or she needs to come out of the game, because I mean, I saw it from the stands where, there was a blow and they're kind of wandering around trying to figure out where they are and then kind of get back into the game. They needed to be evaluated. So I think it's the responsibility of everybody that can be, and it's through education, right? So, I mean, I know as a kid, you weren't going to drag me out of a game. I mean, but we didn't know any better back then. And so I think that education is really important, not just for the coaches and the referees, but also the players. But also, sometimes you may be in a high school or college game. Well, not maybe. You should always have an athletic trainer at that level. But if you're talking about a 10, 12-year-old on a weekend soccer game, you're not going to have athletic trainers on the sidelines. So parents need to also be educated as well to be, and be empowered to pull a kid out. So the most important thing is get a kid out of harm's way. And so when there's an injury, you want to get them out of harm's way. You want to pull them out of the game. You want to have them out of a game, not just for that game, but for probably at least one, if not 2 weeks or more, where they're symptom free and allow the brain to heal. So what kind of symptoms should we be watching for? Headaches is a really obvious one, but some of the subtle ones, you've got a good kid that all of a sudden is a little bit more flying off the handle. They're a little bit more anxious. They're more angry when they were never angry before. They're losing their temper and they never did before. So that volatility in their emotions, which in a teenager, granted, it's sometimes difficult to tell. But I've also seen instances where you've got straight A students who now all of a sudden are failing classes. That's a major red flag. And when they looked into it, there was a couple of concussions that the kid, once it was confronted with it, admitted, yeah, I probably, took a few blows to the head. So, things like grades falling off and just not, nobody knows a kid better than their mother, really. And so those are the kind of things that just those intangibles sometimes, not just the headaches that won't go away, not, and obviously you mentioned like, you don't have to be knocked unconscious to have some major deficits following a concussion.
Yeah, and that's so important to know, is I'll give expert reports from neuropsychs and like they couldn't have had a concussion. They didn't lose consciousness. They weren't vomiting. They were, I'm just like, this isn't even criteria. And the other
I
thing
know.
that
I see that all the time. From neurologists even. It's
Mhm.
like, how can you call yourself a neurologist and actually put that in writing that this patient could not have had a concussion because they did not lose consciousness? I'm like, how can you say that in today's world? It's absurd to me.
Absolutely. And the other thing is, with those symptoms you were talking about, behavioral issues, grades, and it's really important because it's not necessarily that you have to have every single symptom pops up immediately when the injury happens. We think about like you played football and rugby, I played soccer. How many times did we get banged up in a game? We finish it up, and then afterwards we're limping the next few days. It's like, look, as the adrenaline comes down, you can get symptoms that start popping up. And we see this in the NFL all the time where you're like, whoa, someone's on concussion protocol. But during the game, they finished it up and everyone thought they were okay. And I want to go into, you'd mentioned, hey, if you've got these, you probably should stay out for 1 to 2 weeks. Now, you were saying 1 to 2 weeks, and that 1 to 2 week period was being symptom free for 1 to 2 weeks, or typically
Well,
from the injury.
it's every single case is an individual and needs to be looked at that individually. And so ideally, you would want to be out for, roughly 2 weeks symptom free, but that's not always the case. And it also depends. Little league soccer is not the end of the world if you miss a game or two, right? And maybe not the emphasis in the big money game of, say, college football, but it's and the science seems to be changing a little bit more as we learn more, and so that progressive return to play type of attitude, modality, if you will, is really important. And so it's sort of like, crawl, walk, run, play type of thing. And, so that's where that exercise starts to come back in is as you're pushing an athlete a little bit more, can they get up to game speed and still be symptom free? And that's a major, major criteria. I always think about, I have to think of it as just blanked on the name. He was the best hockey player in the NHL, best player in the world, probably about 10 years ago.
Oh, Sidney
Canadian.
Crosby.
Uh,
Is it
what's
Sidney
that?
Crosby? Sidney Crosby?
Sidney Crosby with the Pittsburgh Penguins, right? And he had a concussion on 1 week. I think it was a Christmas Day, and then 1 week later on New Year's Day. And he was not kept out more than a week, and he really probably shouldn't have been playing that second match game a week later. And he had another concussion on top of the first one, and he was out of hockey for about 18 months.
Mm-hmm.
And everything I read, all that cognitive testing, all came back pretty quick. But what kept him out for about 18 months was when he would get up to game speed of skating, he had a slight issue with balance that, we're talking about 99% better. And it was just at that professional, at that high elite level, that 1% at the end was all the difference. And so that kept him out of the game for, like 18 months, because when he was skating at full speed, game speed, he wasn't quite 100%. And so every individual should be treated individually.
Correct. Absolutely. Because symptoms they're really just misleading in concussion. Because we know with the research, if you have concussions, your risk of other injuries goes up. There's also research that I've read in the past week or two that even showed on like single task or dual tasking, you saw increased activation in the brain with single, and then actually the dual tasking, the brain was basically fatiguing. But the kicker is the performance was considered adequate. It was like the same as someone who didn't have a concussion. And so it's kind of the same thing in the psych testing. It's like, well, they did good on the cognitive test. It's like, well, did they do good from what you could measure? And I think that's one of the big things that's still lacking in the concussion world is we have symptoms, we've got neurological based testing like eye movements and balance, but I don't yet have a great way to evaluate the oxygenation issues and then the inflammatory immune system issues, which I know we'll talk about those a lot as we dive into fish oils. It's really it's that immune system with concussions is what really determines your ability to recover short term, but then the
as well as
long-term
long term.
issues, because
Yeah.
what are some of those long-term issues? Because I know one of the things is you were involved with the military in a longitudinal study of traumatic brain injury. Was there anything interesting that was found there or that you've just learned in your other research and observations on the long-term effects of traumatic brain injuries? And I think we should note that concussions are the most common form of traumatic brain injury. And we've got to let that old stigma of like, oh, well, a concussion's not a TBI. It is the most common form of TBI.
Right. It just, you don't want to worry a mother too much by saying your kid just had a traumatic brain injury. So we soften the blow, call it a concussion. And it is a traumatic brain injury. So you're right. That's one myth that we've got to certainly try to dispel. And there's plenty of others, that's for sure. But interestingly enough, I'm just thinking about the recovery aspect of things. And it's funny how things come about. Out of University of Toronto a number of years ago, they were doing a study, and what they found, it was just observations. And what they found was that the teenagers that ignored the advice of go sit in a dark room and don't do anything until you get better, the kids that ignored the advice were getting better faster. And somebody realized this, and then that is how the whole exercise thing started out. Because okay, if they're not just sitting around doing nothing, what if we exercise? And so it carried on from there. It was probably, almost not 15, but probably about good 10 plus years ago. I was talking to the head of the program at Stanford, MD, PhD, neurosurgeon, inventor, entrepreneur, the guy that started the Brain Trauma Foundation, sets all the standards for acute care and brain trauma. And I was asking him, I said, so what do you do with the athletes? And he goes, well, when I have an athlete, he was the head of the Stanford University program. He goes, when I have an athlete that has a concussion, I put them on a treadmill the next day. I'm like, okay, well, what if they have a headache? And he goes, kind of jokingly, but not so much. He said, I give them a Motrin and I tell them to keep running. They're athletes. They just get better so much quicker. And that was like 10, 12 years ago, way ahead of his time. And he goes, so he started, exercising athletes within a day after a concussion, just not putting them back into the game, but getting their heart rate up. And so, you need that blood flow, you need the adrenaline that helps healing. But the other thing, just in this last year, that I thought was interesting was a similar study came out, like the University of Toronto study, and it showed that the kids that ignored the advice and went back to school sooner got better quicker. And so that has changed now the return to school aspect of things that were, if you're following the most current research, kids should be getting back to school sooner, with one minor, not so minor, but one exception is that they should be limiting their screen time, but they should be back into school with accommodations, because the quicker they get back to school, the quicker they recover. And so this idea of go sitting in the dark room, no screens, no this, that, or the other, take away the phone, that's how kids communicate. And so, you're taking away their communication. You're having them sitting at home, not doing anything, not on screens, and not communicating with their friends. So no wonder they're not getting better, because now you're throwing almost, the prerequisite for depression on top of things, because, we're human. We need socialization. So all these things go together towards helping to recover.
Yep, absolutely. You know, I mean, I always tell my patients screens, our brains were not meant for the screens. You know, I have them, I'm like, look, you got to get printed material. Let's do as much of audio as we can, but screens really hurt quite a bit. And then the other part you mentioned, right? We do know based upon the research, if someone has depression heading into a concussion, it's going to take them longer to recover in general. Or else if they develop depression, because they're isolated, that also is going to prolong symptoms. And with what we've talked about with exercise, I'm going to ask you to put out just a few little guidelines because we know people who are listening to this or watching it are going to say, all right, well, I can't have my kid doing nothing. You know, let's get them active. Do you have just a few little tips of ways that parents can do it, or maybe a coach could do it for their kid, their athletes, to be able to get some sort of physical activity without being like, oh, that was the worst advice I ever took. I was in a flare for a week.
Right. Well, I mean, and I can't give specific advice, so nor should you, in this format. But so you should work with the treating physician, but it's that crawl, walk, run type of thing, and so that's that return to play progression, where at a minimum, it doesn't matter whether a teenage athlete or a 56-year-old that slipped on the ice or was in a car accident. You need to exercise, and you need to, even if that means taking a walk around the block. And so, maybe you can walk around the block once and then you feel wiped out. Okay, that's fine. Good for today. Tomorrow try it again. See if you can walk 2 blocks around the, 2 times around the block. So you want to, I always tell my patients a mantra is push yourself, but don't hurt yourself. So you want to push the limits, whether it's screen time, reading time, exercise, whether that's measured in mileage or minutes. You want to push yourself, but not to the point where you feel worse. You want to push yourself up towards that. And there's more scientific ways to do that. A great way is by heart rate. And so if your heart rate, your resting heart rate 60 and you're young, so you could get your heart rate up to 200 if you're running at a full on sprint. So, but now you get your heart rate up to say 120 and you start to feel terrible headache and dizziness. And so now, well, that's my threshold. Don't let your heart rate get that high. So, maybe get up to 100, kind of keep it there for 10, 15 minutes and then back off for the day. And that threshold is going to get better and better and better as you go on. But even an elderly patient, I always tell them, the most important thing you can do, and I prefer outside because I want fresh air and sunshine, hopefully. But go outside for a walk, and like I said, whether it's one time around the block or, 3 miles in the woods, great, but push yourself a little bit. And, if we're talking about more of an athlete and a kid, okay, so now you can walk, you can walk at a slow pace for 15 minutes. Good. All right. Now you can walk at a fast pace for 15 minutes. Great. All right. Now what can you do? A slow jog, so you're picking up the pace to jog, and then you're getting a little bit more running. I love sending kids back to practice as long as there's no contact, right? Even if it's go to your soccer practice and you're not participating at all, anything, you're just running around the track on the outside, but now you're at least feeling like you're back part of the team. You're involved in the team meetings and things like that. But then all right, then you're doing some drills, no contact, no contact, no contact, right? And you work up to that. So you go from the walk to the jog, to the run, to the sprint, to the game speed in practice before you get back to getting back into the game.
Yeah. Yeah. That socialization component is so important. And then, like I said, anything is better than nothing. You don't want to flare up your symptoms, but, don't be so scared. Like, I love stationary bikes. I'll tell people, look, just do like 3 minutes, 3 to 5 times throughout the day. Don't try to do 30 minutes all at once, right? Just view it as like you've got to sub yourself out of the game. That's okay. And like you said, right, if you find at this threshold you have issues, I typically tell people do 80% of what causes an increase of symptoms. Right? So
Exactly.
if you said
Right.
120, hey, do 100 and tolerate it, cool. Then you can go up. And, and this is where having a great healthcare provider that you're working with is really important, because they can help coach you along the way, because there's a variety of factors that are going to impact how well you recover and how you progress, and with that, now I want to start talking about fish oils. Now, one of the first brain health research studies in nutrition was looking at suicide in active duty military that you were involved with. Can you tell me about that?
So as I was asking the original question, as anybody look at this, I knew I had to find out who knew anything about it. I had to educate myself, and there weren't, like I said, only the neurosurgeon in West Virginia, Julian Bales, who is now up in Chicago. But and some people might remember him. Alec Baldwin played him in the movie Concussion. He and I were the only ones really looking at omega-3s and specifically in brain injury, and still not a whole lot of people to this day are. But so I had to look elsewhere. I had to find out who knows things about omega-3s in the brain in particular. So I got to know a psychiatrist at the NIH. He and I became really good friends, and I was just learning as fast as I could from him. He had been doing 20 years of nutrition, and particularly omega-3s in psychiatric diseases. And so, it's the brain, right? So I can learn from him. And at one point we were out, and I think he asked me, if we could draw blood on people before they commit suicide, we could probably answer a lot of questions. I'm like, oh, why didn't you tell me that before? That's easy. And he looked at me like I was crazy. How do you know who's going to commit suicide? He's like, the U.S. military, DOD, every time they draw blood on somebody, what's left over, they basically put it in a freezer in the outskirts of Washington, D.C., and it's got all of DOD's data behind it. So I think now there's something like 75 million specimens sitting in a freezer. And they've been doing this since around 1992 or so. And so, we put together a research study. We looked at 100 well-documented suicides, 100 suicides a year for 8 years after 9/11, because we wanted to look, is there a component to wartime service with this? And 800 well-matched controls. And what I didn't realize, and I found out later, was we had 800 suicides, well-documented suicides. And I come to find out, in that same time period, there were like 3,200 suicides of active duty military during that same time period. So, but what that allowed us to, I think, actually made the study even more valid, is all the blood work had been drawn on those suicides within 6 months before they committed suicide. And so, lipids, fats are really stable in the blood. So we felt very confident about that. And of course, we had tons of matched controls to be able to choose from. And so what we found was a 62% increased risk of suicide in those soldiers and sailors and Marines who had a DHA, omega-3 level of 2% or lower. So low let me put that in English. So low omega-3 levels in the blood correlated to a 62% increased risk of suicide, something that we could change literally for pennies a day with supplementation. And in fact, I said we had the DoD's data behind it, right? So we were able to look at who had been deployed, who had been seen for psychiatric reasons or mental health, sought mental health care. And none of those factors were anywhere near as important as literally just what were their omega-3 levels in the blood.
And that was the total omega-3s, not just like, well, EPA versus DHA. It was just a combined total omega-3 level.
Well, omega-3 levels, I mean, all these were significant. So omega-3 levels, but what we really focused in on was DHA levels, but omega-3 levels as well. And interestingly enough, the average omega-6 to omega-3 ratio was 26-1, out of balance. Omega-6s and omega-3s are meant to be in balance. That's how nature designed us. And we, as a society, a reflection of society, we were at 26-1 out of balance of omegas, too many omega-6s to the amount of omega-3s that we have in our blood.
Yeah, so let's break this down a little bit, because a lot of people are like, okay, what is this test, right? Like, can I get the test? Can my kid get the test? So I know there's different versions of this test out there, but what's one of the ones that you like for measuring omega levels and then even breaking down the ratios and kind of the distribution for the types of omega-3?
Right. Well, the most tests that have been done. So typically it's a finger prick type of test, drop a couple drops on filter paper and send it in. There's a couple companies around the US that do this. My favorite actually is out of Oslo, Norway. They've done over, I think now probably about 1.6, 1.7 million blood spot tests for omega-3s. A company called Zinzino, Zinzino, and their balance test. And it's that finger prick drop, on the filter paper, stick it in the mail, and you get results in 2-3 weeks. And what it's looking at is a number of different omegas and of different fats in the blood. And the two most important numbers are your omega-6 to 3 ratio, which is actually your EPA, your arachidonic acid omega-6 to the amount of EPA omega-3 ratio. So let's just keep it, as omega-6 3 ratio. That's the most important number most people have no clue about. Most people know what their cholesterol is, right? Some people are going to know what their vitamin D levels are, which is really, really important in this whole talk as well. But most people have no clue what their omega-6 to 3 ratio is. And like I said, in the military suicide study, 1,600 patients, we had a ratio 26-1. The second number that you can really get out of this is your omega-3 index. It's the total percentage of your omega-3s, your EPA, your DHA, your ALA, all these combined. What's the percentage of all the fats, the fatty acids in the blood? So you should have an omega-6 to 3 ratio of 3-1 or better. 3-1, 2-1, even 1-1, which is how we were designed. So that's the most important number, and easily the second most important number, or maybe just as important, is that omega-3 index. It should be 8% or higher. So unfortunately, when we, like I said, with the suicide study, we weren't looking at 8% or anywhere near it. It was the total omega-3 index was around 3.5%. And why is that important? Well, obviously for brain health, because that's what we're talking about, but also your cardiovascular risk. When you're at 3-1 or better, or 8% or higher, your cardiovascular risk goes down by almost 50%. And so it's something that we always talk about cholesterol, but nobody's talking about these omega-3s and your risk factors. It's probably more important than knowing your cholesterol.
Yeah, it's important when we talk about these numbers as well, as I do one called Omega Check, and the lab reference range, you've got to kind of ignore it. Whenever we're looking at a total omega-3 level of greater than 8%, most labs are like 5.5 or above. They're like giving you 2 thumbs up, gold stars. And really on the omega-6 to 3 ratio, most of them are just like, they kind of almost consider anything normal. They're not looking at a 3 to 1, a 2 to 1. And that's the other thing. So for those that are going to ask a provider to get this test, like, actually look at your values. Don't be like, oh, well, they told me it was normal, because what the lab considers normal and what's truly best for health are 2 different things.
Well, and we could pick on anything. Let's pick on testosterone in men for a second, just because it's a pretty straightforward way to explain it. And there's some tests I say you got to look in a horizontal way, like TSH for thyroid, where it's from 0.4 to 4.5. Well, that's a huge log scale range, where on that horizontal scale, you want to kind of be more in the middle, like around 2, right? So you want a much more narrow range. It's optimal, not just quote unquote normal. But let's, in the testosterone, I look at it more in the vertical way scale. And so, different labs, different values, but it's generally around a total testosterone of 300 at the low end to 1100 or 1200 at the high end. And that's not a range. It's a 3 or 4-fold difference. And, so and people want to call it a normal range, but it's not a normal range. It's the reference range. And so what's the definition? It's over the last 10,000 tests that were done by that lab, it's the mean plus or minus 2 standard deviations. That's all it is. There's nothing normal. So if you've seen studies, decade after decade after decade, the average testosterone level in a 40-year-old male, let's just say, has come down decade after decade after. It's gotten lower and lower and lower. So that reference range continues to change, but has nothing to do with optimal.
Correct. And I'm going to have you define that one more time.
What's that?
I said, I'm going to have you define that one more time, because I really want people to hear that again, because people get so stuck on a lab range. But define once again, walk through how they come up with the reference range, because we need people to really see this from what the range is versus what kind of is reality.
Well, it's not just that. It's really, I would argue, it's what's the quote unquote normal range or the reference range compared to what is optimal.
Mm-hmm.
And, I want to explain it in terms of that most people can understand. If you're in high school and you're taking the SATs, do you want to be in the 5th percentile or the 95th percentile? Right? You may get into Harvard or Yale or Stanford if you're in the 95th percentile, but they're not even going to think about you if you're in the 5th percentile. So, optimal, maybe you can understand it in percentiles like that, right? So we typically want people to be, and depend on what we're measuring, but something like testosterone, we typically want to be 75th to 95th percentile. That's optimal, where you're going to feel good and where you should be. You take a 45, 50-year-old man and they've got a testosterone of 302, and the doctor looks at it and doesn't see an L by it, saying it's low, and says, oh, you're normal. Well, okay, but is it optimal is the question you should be asking. So again, it's determined by the lab over like the last 10,000 tests. You're looking at the mean plus or minus 2 standard deviations. So it's completely a statistical thing. It has nothing to do with, are you normal? Are you optimal? Are you anything other than, do you fall within 2 standard deviations?
Yep. So ultimately, there's a lot of sick people who are in there. They're skewing the values. It's just like a test score, right? You've got lots of people who don't do well. They're changing what the median number is. They're changing what the average is. And it's, we could talk about this with so many labs, but, with us focusing on omega-3s, we've talked about kind of the ratios of three, the 6-to-3 ratio, suicide. But what do omega-3s even do in the brain? Like why do we take them, specifically DHA? Like what's it doing?
Well, and some people, I give a lot of talks around the world, and sometimes the sophisticated audiences will like, well, why do you even bother with EPA when we're talking about the brain? I'm like, how do you discount EPA and only focus on DHA? And so the quick backstory on that, right, is omega-3s. They're carbon, so ALA is 18 carbons in length, EPA is 20 carbons in length, and DHA 22 carbons in length. And why we call it omega-3s is from the end, the first double bond is 3 carbons in from the end. So if you were to take one of those high school chemistry balls and sticks and make a DHA molecule with the double bond, what you would see is it's a very flexible molecule. Whereas an omega-6, the 20 carbon arachidonic acid, which is the main one found in the brain, it's got, right, that omega-6. So the first double bond is 6 carbons in. It's a very stiff molecule. And you would see that if you had a model. So it's very stiff. So let's look at red blood cells for a half a second. So just red blood cells floating around. You got EPA and DHA. You got arachidonic acid in there. And if you have way more arachidonic acid, you've got stiff molecules in the membrane of the red blood cell. Well, the red blood cell's got to, you think about it going through the smallest of capillaries, and that red blood cell's got to squish through in those small capillaries. Well, if it's a stiff membrane, it's not going to do that very well. So it's just not going to happen. Whereas if you've got flexible molecules in the membrane, that's going to happen a lot easier. So, that's just a structural component of it, and that's also correlates to a stiff membrane is not going to allow the inflow and the outflow of the different types of things, whether it's calcium and potassium or toxins in and out of the membrane. You need a flexible membrane, and it helps allow essentially like the cell to breathe. And, obviously no more important than in the brain. DHA is what's found typically in the membranes, whereas EPA is more of the downstream important in heart health. But the downstream effect from EPA helps relax blood vessels so that the blood can flow easier through there, whereas DHA is more in the membrane of cells, most concentrated in the retina, and second in the brain. And the downstream effect, there's constantly, this constant turnover. And as the omega-6s and the omega-3s are released from the membrane, the downstream effects have two different things. Omega-6s are pro-inflammatory, and omega-3s are anti-inflammatory, those downstream effects. And also the downstream effects of DHA, they've got things called resolvins and protectins. So the names kind of tell you what they do, right? And so that's really important in inflammation. So you got the pro-inflammatory and you got the resolving, it's a little misnomer to call it anti-inflammatory. It's more resolving, but we'll just keep it simple and call it the anti-inflammatory, meant to be in balance, right? That 1-to-1 ratio. But when we're 26-to-1 pro-inflammatory to the anti-inflammatory, it's no longer a fair fight. The other place where it really has an effect in the blood cells arena, again, is the omega-6 downstream effects are pro-clotting, whereas omega-3s are pro-not clotting, right? Anti-clotting. And so it's meant to be in balance. So your blood needs to be able to clot, right? You have a damage to a blood vessel, you cut yourself, you want your blood to clot. But if your blood clots too easily, that causes things like heart attacks and strokes, right? So obviously, we want a good balance between pro and anti-clotting as well as pro and anti-inflammation. And I'll just kind of bigger picture thing. Muhammad Ali, right? Took a bunch of hits to the head as a young man, died of Parkinson's much later in life, but it was sad to see, how he aged. Was there a connection? I think most people would argue yes. The question is, what's that connection? I would argue that connection is inflammation, and that the inflammation never quite gets resolved. And that's where we are with our food supply, where we're not providing the things to help resolve the inflammation. That's where we start talking about CTE with football players and others. It's this chronic inflammation that we continue to be exposed to that makes all the difference in the world.
Yeah, absolutely. I think it's the inflammation as well. That's the biggest thing. And that's where some of this imaging in the future looks pretty intriguing, because they can actually detect the inflammation that's still persisting. And, there's even research that was done, University of Montana or Montana State. They looked at football players that were doing a blend of fish oil supplements before the season and throughout, and they saw less brain damage with subconcussive blows compared to those who didn't take any fish oils. They were looking at a marker called
Texas
light
TCU.
TCU?
TCU, Texas Christian University, 2014 football season.
Okay, they did this one there too.
Well, that was the one that kind of started this whole process.
Okay.
Jonathan Oliver was the lead researcher. I was an advisor on that. And what they did was they started June 1st through the end of the football season, and they had everything from zero, placebo, and different levels of omega-3s, principally DHA. And what they found was that neurofilament light, a marker of inflammation, was decreased or blunted, is a better way to put it, with the omega-3 levels with the players that were taking omega-3s versus the ones that were taking a placebo. And so, while it wasn't enough to show that it decreased concussions, they actually had half the number of concussions that they historically would during a year. But the numbers weren't big enough to be able to report that. They were able to show that the neurofilament light was blunted with omega-3 levels.
Which is massive, because neurofilament light, which, we don't have time to go into it, but it's ultimately a marker of damage. And so that's super important. And so when we're talking about preventing concussions as well as helping people recover, one of the first things we talked about is there's just not a lot of talk about nutrition. So we know the omega-6s are bad. What are some of the foods that people are eating that, you're just like, look, parents, coaches, trainers, please just have your athletes stay away from these. It's driving a lot of inflammation.
Well, omega-6s aren't inherently bad. They, we just consume too much of them.
Correct.
And so so they become bad just because of the abundance of it. And so you need omega-6s to make a brain and keep a brain healthy. But again, it goes back to balance, and you need that to be balanced with the omega-3s. So pre-industrial revolution, that ratio was really pretty close, or around 1-to-1. And we're talking about, people that live nowhere near the ocean, didn't have access to seafood, and yet the ratios were still pretty good. Reason why? Because you're eating wild game and natural things from nature, and everything from in today's world, you think of, say, hunting wild deer type of thing, or free range chickens might be or grass-fed beef. Once the Industrial Revolution came along, then that ratio started to change. But then it really accelerated in the late 60s, early 70s with the Farm Bill. And, how can we grow more calorically dense foods industrially? And the food that fit that the most was soybean. And so that rate, the amount of soybean consumed in the United States went up 16 to 20%, or not percent, 16 to 20 fold, like 16,000%. And you're like, well, but I don't eat soybean. Well, you think you don't, but you do. It's in everything. It's everything from the bottle of salad dressing. If you look, one of the first ingredients, soybean oil. But it's also what's fed to, soy and corn are the principal animal feeds in the country. And it's what's fed to the cattle and to the chicken, to the pigs and so on. So we consume huge amounts of soybean, whether you know it or not. And partly because the omega-6s are not only a stiff molecule, but they're shelf stable, right? So you could put a box of crackers out into the sun for 3 days, might be a little stale, but you could still eat them. You put a piece of fish, which is high in omega-3s, you can put it in the sun for an hour and you may not want to eat it, right? Because the omega-3s are unstable and they spoil quickly. So what do we do? If we want to process foods and ship it around the world, you're going to process them with omega-6s because they're stable. So the processed foods are what's really had an impact on our omega-6 to 3 ratio. So we've gone from 1-to-1 to 5-to-1 to 25-to-1 over the last, since World War II, really. And so it's really about that ratio. What we need to do is we need to get back to eating more wild game. But so principally, the biggest and best source of omega-3s to offset those omega-6s is fresh caught seafood. Basically, salmon is about the most perfect food. The wild caught salmon is about as good as you can get, which nowadays we can ship it around the world and you can get access to it. And like I said, 50 years ago, you couldn't get access to fresh salmon. So it was, how did that change? It's important. So good wild caught seafood is our biggest source of omega-3s, but also leafy green vegetables, the spinaches and the dark green vegetables. We just got to get back to, and you probably do this in your own practice, right? What am I really describing here? A Mediterranean diet, right? So if you want a word or two for somebody, like, geez, I don't remember what he said, just remember this: Mediterranean diet. And that will tell you everything you need to know. It's the only diet, if you will, and it's not really a diet, it's a way of eating. It's the only diet that's ever been shown to actually be good for cognition. It's the only one that's ever been scientifically studied and shown. And so you think about what a Mediterranean diet is. It's eating closer to nature. It's, lean proteins, more seafood, fruits, nuts, vegetables, what nature provides us, not what man has processed and puts in your fast food bag when you go through the drive-through.
Yep, absolutely. It's getting rid of a lot of the processed foods, going more, like you said, healthy, fresh fish, wild caught. And not everyone's going to get everything they need from the fish, or else their numbers are so skewed because of what they've been exposed to. And I know you've been around the fish oil industry for a long time. And people see all sorts of different stuff in the grocery stores. They see it on Amazon because fish oils, they're being talked about a lot more in general. And people are going and they're spending all sorts of money on it. But what should people know about what they're doing? What should they even be looking for so they can make sure they're getting what they hope they're actually getting?
Well, unfortunately, you get what you pay for, is as the old adage, right? And so if you think you're getting a good deal because you're going to a big store and getting a gallon of fish oil for $5, you're probably not getting a high quality fish oil. I would argue in some ways, any fish oil is better than none, but better and more fish oil is, omegas are better than some, is one way to look at it. So you're right. I've been around the industry a long time. I know a lot about the manufacturing and a couple of things. So I'll say you go to your local drugstore and you get the generic brand of fish oil. It's 1,000 milligram capsule and it has 180 milligrams. And this is the only important part. How much EPA and how much DHA are in that capsule? And so you got 1,000 milligram capsule and you have 180 milligrams of EPA and 120 milligrams of DHA. Add them up. What do you get? You got 300 milligrams of EPA and DHA, or 100. We'll just call it omega 3s in general. So you got 300 milligrams of omega 3s, but it's 1,000 milligram capsule. What's the other 700 milligrams? Oh, I don't know because they don't tell you. Right? So you don't know what you're getting in that. And, knowing a bit about the process, let me dispel one other myth. There's as close, I'm not going to say zero, but there's as close to 0% chance of getting bad things in a fish oil as in terms of mercury, PCBs, heavy metals. Every fish oil in the market goes through a cleaning process to clean those things out. 100% of the fish oils go through that process. It's not 100% exact, but so it's as close to zero as you can get of risk of getting. So if you hear, don't take fish oil capsules because you'll get too much mercury, I call BS. It doesn't exist. It's not an issue. But it's quality. So the best products, if you're just talking about a capsule, the best products out there are going to be, so if you think about 300 milligrams in 1,000 milligram capsule, it's a 30% concentration is one way to look at it. The best products available in the market are actually in triglyceride form, which is you squeeze a fish, that's what you get, and 90% concentration. Well, if you're going to talk about what does it take to get a 90% concentration in a triglyceride form, that takes some serious manufacturing and manufacturing know-how. So it's going to be more expensive. But the quality that you're going to get is exceptional and far better than your cheap generic brand that you get at your local pharmacy or drugstore. So, I mean, I could go way into it far more if we had more time, but I'm going to leave it at that.
Yeah,
you get what you pay for.
Correct. You get what you pay for, and don't get so distracted by the front label where they say you get 1.5 grams or 1 gram. Know what's on the back, as you've talked about, because you may not be.
You have to learn to read the labels. Yeah.
What you're hoping, and
I mentioned triglyceride form, and let me just say a couple of words really quick about that. Triglyceride form. You squeeze a fish, you get mostly triglyceride form, and that's really important. The manufacturing process, when you're going through that cleaning process, they break apart that triglyceride and they have to combine it with something like sodium needs chloride, to stay stable, your acid and the base, so they combine it with an alcohol molecule. And that's called an ethyl ester now. And they're able to more easily separate out the good from the bad and get rid of the mercury and all that. But what the cheap ones do is they just put that in a capsule and sell it. It costs like nothing to make. And so you've got this ethyl ester. So if you're looking at a label in a bottle and it does not tell you it is specifically in triglyceride form, it's an ethyl ester form, without a doubt. And, there's no exceptions to that I know of. And why do I bring this up? Because you eat fish and it's triglyceride form, our body knows how to digest it. We have the enzymes to digest triglycerides. It's just part of natural food. And so we can easily digest triglycerides. But our body, ethyl esters are a new thing. It's only been around about 2 or 3 decades. Our bodies don't know how to digest ethyl esters. And so you're wasting your money anyway, because so little of it actually gets through the intestine into our bloodstream because our bodies don't know how to digest the ethyl esters. So you're wasting your money anyway, spend a little bit more money, get a good triglyceride form, and get one that's concentrated and even better for you.
Yep. Absolutely great information, and then with your book, When Brains Collide, where can people get that from if they want to?
So I'm going to hold this up. I know I've got sort of that green screen, so I'm going to hold it up over my face for a half a second so people can see it. Hopefully that comes through.
Right there.
Okay.
Yep.
So you got an idea what it looks like. When Brains Collide is available principally on Amazon. It's a just-in-time print. So you order one, they hit the print button, and off it goes. So you can find When Brains Collide on Amazon, and it's actually been out for 8 years now and continues to sell month after month because hopefully, people say, well, you should update it. I'm like, there's really not much to update because the message is still the same. So When Brains Collide, available on Amazon.
Yeah. And then last thing I wanted to ask you, and have you share with people is you've got a nonprofit, the Brain Health Education and Research Institute. Tell people about that really quick. What's it about? Who's it for? And where can they learn about that?
So when I retired from the military 13 years ago now, I started Brain Health Education Research Institute, education and research. So I, used it to be able to try to influence research, but also as a forum to be able to educate people. And so brainhealtheducation.org or Brain Health Education on Facebook or Brain Health Ed on Twitter/X. Information out there. I'm constantly putting out educational information. Every day I get feeds on what's the latest news in brain trauma and omega-3s. And so I put out interesting articles all the time principally through the Facebook. I used to send out a newsletter all the time. I'm starting to get back into that. But over the last few years, there's been more and more of a need and people asking me for it. So we basically have started to, in addition to education, we're doing a little bit more direct care, principally of veterans, but we're looking to expand beyond veterans into, there's so many concussions. There's millions of concussions a year. So there's a big need for help, for not just for the information, but what do I do? And so we're transitioning into a more of a service organization, if you will. And so our service side, think of Brain Health Education Research Institute. Think of the initials BHERI.org or Berry.org. BHERI.org is more of our service side of things, in addition to the Brain Health Education.org education side of things.
Okay, awesome. Well, thank you for joining us today. This has been awesome, talking about concussions, omegas, and just so much more to help parents and loved ones of those who've, had people in their family who've suffered a concussion, or even individuals themselves who've had concussions and are trying to help, in that acute phase, but also long-term keep their brain in the best spot possible. So thank you for joining me.
Oh, you're welcome. I would say, When Brains Collide, just in case you're timid about, thinking about getting it, the audience, the book is written for the soccer moms out there, really. So I say moms can change the world, and that's who I really wrote the book for. So, think of it in those terms. It's not a textbook. It's written for the moms out there just trying to make a difference in their family.
Awesome. Thank you.